My name is Gloria Ani Asamoah, and I am a family physician with Kelej Polyclinic. It is a public health institution. I have had the opportunity to do 2 different programs under the Merck Foundation nationwide diabetes and hypertension Blue Points program. The first one was Diploma in diabetes, and the second one, which I completed in 2021, was a master's program in diabetes. Prior to starting the program with Merck, I had a lot of interest in diabetes, but in school and during my house management, I realized that diabetes was a really complex disease and it had several aspects. But during my practice, I struggled a lot. I actually worked with the National Diabetes Center prior to starting my family membership program. That was when my interest in diabetes began to grow, and I thought that I would like to know more about it. I would like to understand it so that I can manage this condition better, because the patient came in with lots of complications. Some of them were able to deal with, some we just could not understand. So when I started my fellowship program and I was informed about this diploma, initially I was hesitant. I thought I was going to be difficult combining that with what I was already doing. But I also encouraged my senior colleagues that I should give it a try. It is an online program, and I will can make ample time to go for it. So I entered into the diploma program, which was an excellent program. I learned a lot of things. I got to know more about diabetes, how to manage these patients, the complications, and how to deal with it. So after that program, I was really in to take care of our patients with diabetes, which, even further made me more happy when they offered me the program to do the master's as well. The master's program was more geared towards research work. So we had the opportunity to do a research in diabetes. And as I did the research, I realized that in our part of the world, actually, there's very few research when it comes to the area of diabetes. So this is an interest that they have really sparked in me, and I'm hoping to go ahead to do more research in the area of diabetes. Currently, I'm doing my fellowship, and I'm actually working on something with diabetes and TB. I have also just finished a feasibility study that I'm doing with my senior colleague who is a diabetologist. We are doing a feasibility study on self-structured education in patients with cardiometabolic disorders, which include diabetes, hypertension, obesity, and patients with high cholesterol. And I must say that it was a 6-month feasibility study, and after the 6 months, we saw very significant improvements in certain aspects of patients' life. And so that has been a really great achievement for me after my master's program. Definitely, this program has also encouraged me, in the management of this patient. I've come to realize that it's not easy to manage our patients just in a regular OPD. Sometimes you need to have a special clinic for them. And so we have started the chronic care clinic for patients with cardiometabolic disease. We are seeing patients with hypertension, diabetes, and other conditions. So usually this is an appointment clinic, and so they just all walk in. So we call them and we give them appointment days, and they come in for us to see them and to manage them. It is our hope that through the clinic we actually will be able to collect some data to be able to do some proper analysis on sort of patient we are seeing, what are their control levels like, what complications do they have, and what medications they are on. We believe that if you're able to collect such data, we can be able to also do more research in this area, or even write more papers with regards to management of chronic care in primary healthcare setting. And so that is one thing that I am looking forward to do in the near future. As we go on with the clinic and we build our clients level, we will likely have enough data to be able to do that. And after I have completed the program, a lot of my colleagues also did ask about it, and I informed them that this was a program that was sponsored by the Merck Foundation Nationwide Diabetes and Hypertension Blue Point program. And so they wanted to know how it came about. I showed them that the First Lady actually is part of this whole program, and they have allowed Merck to come and, engage doctors in various healthcare sector to take these online courses so they can still work in their various facilities and still improve their knowledge. And some of them have actually gone ahead to take some of the courses in the diploma, and others are also doing the master's degree as well. Some have also done other, courses with the Merck in other areas. And they have all said that it's an excellent program and they have done very well and they have not regretted in any way. I think that Merck is doing such a great job because it is not easy to train such large numbers, and we don't get to do anything for them. What they rather do is help us, equip us, get the knowledge, and also help our patients as they come into our clinic. We are grateful to Merck. We are grateful to the First Lady for allowing Merck to do this in our public facility. And it is our hope that even as we acquire this knowledge, we will continue to serve our people better, serve our nation better, and make Merck proud of us. Thank you very much for the opportunity.